And one day after Governor Raimondo unveiled her $9.4 million budget plan for the upcoming year, we're taking a closer look at one of the changes that could impact thousands of Rhode Islanders' wallets: proposed cutbacks to Medicaid. Eyewitness News reporter Kim Kalunian joins us now with new details.
Well, nearly 1 in 3 Rhode Islanders is a Medicaid recipient, and those at the Economic Progress Institute believe this copay proposal could impact more than 130,000 people, potentially dissuading them from getting medical attention when they're sick or getting the prescriptions that they need.
I'm very worried about that.
Policy Director of the Economic Progress Institute, Linda Katz, is concerned about Governor Gina Raimondo's budget proposal to have adult Medicaid users make co-payments on certain medical services. Under the governor's budget, adults in the Medicaid system would pay $3 for non-emergency hospital visits, $8 for non-emergency ER visits, and $3 for non-preventative doctor visits. On prescription medications, they would pay $2.50 for generic drugs and $4 for brand name.
Even that small amount of money can mean, well, maybe I'm not feeling so well, but I won't go to the doctor today because I really can't afford to shell out $3.
Rhode Island would join 24 other states in implementing copays, but the proposal has drawn criticism from both parties. Democratic Senator Janine Calkin tweeting, "So we should ask seniors, the disabled, and the poor to pay more via Medicaid copays, but can't ask the very rich to pay a little more by restoring the 40% tax cuts they've received since 2006? Unacceptable." House Minority Leader Patricia Morgan is expressing concern over the plan and its potential impacts on Medicaid recipients. The governor says Medicaid is a hefty part of the state budget, upwards of $2 billion a year.
The budget I propose has no cuts in eligibility, but, Medicaid is one of the largest, faster growing parts of the budget.
And to find out how Rhode Island's proposed copays stack up with the other states that already have this program, you can visit our website, WPRI.com. In the control room, I'm Kim Kalunian, Eyewitness News.